Hello, welcome to Health Assessment for Dual Degree students. I am Carolyn Merriman and I'm going to be your instructor this summer. And I also want to give you a hearty welcome to East Tennessee State University. This may be your first course that you've taken. So we're delighted that you've chosen ETSU to take a course for dual degree, and probably some of you are also taking pathophysiology. But I thought it would be a good idea to let you see who I am before I see you this summer for our first lab session, and to go over the syllabus and the course packet with you, and try to also give you some information that you need so that you'll be a little bit more comfortable coming into the first lab session. In general, we will have 4 lab sessions this summer. 3 of them to actually do some lab skills, and also to get ready for what I call the final head-to-toe performance exam. And I'm hoping to show you what that performance exam looks like as well, if not on videotape, then in person when I see you this summer. So if you would, I have put your syllabus, as you know, a week ago, I put your syllabus and your course packet just recently into D2L under course content. So if you will look with me at your syllabus, and I had asked if anyone also, if you want to use the discussion board for questions, that would be fine too. So this is the syllabus, and of course it talks about the overview and the description. But I know also that you all, as dual degree associate students, you've already had your first clinical course, which means that you are far ahead of some of the students I have in health assessment, because you've already had patient care and you've already done vital signs. And so we are not going to specifically check you off. I'm not going to check you off on vital signs, but I am going to include that as part of your reading and your preparation. So this says basically that you will be doing a health history, and that we'll be doing some regional and overall physical exams on a client. And the client in this case will be a lab partner that you choose when we come together for that first lab session. We will be doing a combination of theory, which you're doing on your own, even though I'm going to try to put a few vignettes up for you or a little bit of content up for you as I can. But this online course was designed for you to study through the chapters and the assignments, and then come and do lab skills since you are considered an advanced student. As you can see from the course outcomes, still on the first page of the syllabus, your overall goal is to have a comprehensive health history and a physical exam on an adult client. And we consider adults anyone 18 years or older, so that's who you would be choosing for either of those assignments. And like I said, the physical exam will be done on a lab partner in class, preferably, or you can bring someone from the outside, and we'll go over that in a few minutes. During this class, we emphasize respect and caring while conducting physical assessments, so that means we really keep the idea of protecting our client respectfully through draping and other things that we can do. We also apply legal, ethical, and professional standards, and so that's what we see with most courses. If you'll go to the second page of the syllabus, this is the outline. Now, you've already been assigned readings in the critical thinking and health assessment, the cultural assessment, the assessment techniques and approach. You also have been assigned Chapter 4 in your Jarvis book on family history, individual history, and also some general survey information, which is approach, nutritional assessment, and mental status assessment. You're going to see some other assessments as well. There is a chapter on intimate partner or domestic assessment, domestic violence assessment, and a few others, all the way down to skin, hair, and nails. So that is the first portion that you'll see. And then after that, it becomes more regional, but we apply the introductory concepts to what we're doing. let's go to page 3 of the syllabus, or the third page. It talks about the evaluation methods. So under evaluation methods, I wanted to just share with you about the course. You are going to have actually 4 theory exams, and each one of them is weighted a little bit differently, but the exams are usually 50 multiple choice questions. On occasion, I might put in an alternative item that you're used to now that you're in nursing school to get you ready for NCLEX, because I'm certainly wanting you to do that. But what this evaluation method basically says is that your theory grades will be averaged, and you have to have a 75% average on the 4 theory grades in order to be eligible to do that final performance exam. So which of course you're going to do remarkably well with. So you're going to have 4 theory exams. After you've made that 75% and qualify for taking that head-to-toe performance exam, you also will need to make a 75% on that exam as well. When all of your grades are in, they will be allocated regarding percentages, as you can see on this page. For instance, exam 1 is 10%, exam 2 and 3 are 15%, and then the final exam is 20%. So I usually stick to 50 questions. Sometimes I put a couple bonus questions on, and I also try to keep multiple choice format as much as possible. Like I said, sometimes I have done a select all or a picture or something like that. There are some other assignments too that, as you can see on here, and these assignments include some laboratory write-ups. So when you come for lab 1 and 2 and 3, we will be doing 4 different basically write-ups during that time. Skin, hair, and nails for the first lab session. Then the cardiac, heart, and lungs will be the second write-up. And then the third write-up is the abdomen. And you can see that those at the end of our time together will be worth each 3% of your grade. The final thing that you'll be doing, it's like this is the pinnacle of the course, is that you will perform in front of me and with a lab partner or someone that you choose from outside a head-to-toe performance, excuse me, and we call that a CCE, or a critical competency exam, and it includes a head-to-toe performance and also a write-up. And so I will go through that a little bit more with you in a few minutes. That is, those are the laboratory assignments. You have 1 written assignment outside of class, and that is your health history. And the health history assignment I will also go over with you in just a few minutes. So the next page of your syllabus talks about the overall course requirements. It says you've got to complete and pass all your pass-fail assignments. And basically your pass-fail assignments are finishing your HIPAA and your OSHA requirements, because this is a lab course. So that is to get you finished with those requirements through student services, and that an announcement was put on D2L about that. You are to achieve a minimum weighted average of 75%, and that would be on 4 theory exams, and in order to be eligible to complete your performance exam. Since we're only going to have 3 lab sessions and a checkoff, I really need you to come to these lab sessions. It's really hard to make up these sessions. And then of course achieve a minimum of 75%, including all the critical elements that are on this performance exam. And I'll show you that form in just one second. This is the College of Nursing at ETSU's grading scale, as you can see on this page. And also the required text is the text by Carolyn Jarvis, and it's this book here. It's the 6th edition is what we're using. However, I know some students have used the 5th edition, and that you just have to translate where the assignments are. So that is something, if you've got an old book, that you could possibly do. An optional text, which is helpful but it's not required, is a lab book. It's the lab book. It looks like this, and it goes along with the text. If you do not have a lab book or have access to a lab book, what you can do is I have Xerox some of the core pages for your skills lab that we'll be doing. So if you do not have this, that's okay. If you have it, it will just add and supplement your learning. Some of the other books that I recommended would be an encyclopedia or a medical terminology book, which is always helpful, but you've already had an advantage of having foundations under your belt, so you may not need that at all. The next page, the bottom of this page and the next page talks about the procedure for special services, and we have a policy here at ETSU that if any of you have a disability, a learning disability or some other disability that has been tested, that you could have special accommodations for testing, and you just need to let me know, and that certainly will be kept confidential. If you will look at the next page, it just talks about academic misconduct, and of course we have a policy in the University Student Handbook about academic misconduct, which I don't expect to be an issue with you all. You all are here, you're taking a summer to do a course. I know you're serious about the course. The attendance and preparation, like I said, lab attendance is required of all students. It really is important. It would be very, very difficult. If you have an illness or an emergency, please let me know. And I have put my cell phone number in the syllabus for you. And of course, if you just are absent without notifying me, then there is a deduction in your grade, which I hope will not happen to you. The written assignments, we'll do all of them in the lab except for that health history. And if it turns out that you need a little bit more time, we can negotiate that and get it in. So that will be something that we can talk about. There is an examination policy we have also at ETSU, and that is the exams need to be taken at the time that they're designated. Now, the first exam will be in class, the first session. The other class, we also have an alternative to put them on D2L or do other kinds of testing. So I will let you know if there's going to be an online test versus a test that will be in class. So read that policy. It just talks about if you have an emergency or have to be absent, that there can be some makeup. It may not necessarily be the same kind of test. The lab policy on the next page is important, and this was something that we've written for all our health assessment courses. It says that lab practice and competency testing, of course, are required. Students may select a lab partner among their classmates, or, as I said, you can bring a volunteer with them as long as they're over 18 and they're willing to be your partner. You're expected, of course, to maintain privacy with your partner, and at no time any student that is going to be your partner at any time should there be exposure of any private parts, female breast or male or female genitalia. All of that has to be covered. Your partner can wear comfortable clothing, so that means shorts would be fine, a tank top would be fine, anything like that would be fine. Jogging shorts, tank tops, it even talks about sports bras in here. Whatever will help with you doing your physical exam and make the partner feel comfortable and safe and protected. So that is a policy that's important. So what do I expect here? I expect that you do your readings and ask questions. Since this is online and you don't have all these face-to-face lectures, then read the notes that are also you've got PowerPoints and notes under content. So be sure you read those and then come to each of the labs really ready to participate. I will do some questions and summary activities, and then we'll go right into whatever the lab is designated for the day. So for instance, the first lab time we'll be together is going to be a skin, hair, and nails lab, and after you take your first exam, we will do a skin, hair, and nails exam lab. I will demonstrate that to you. You'll get to do it, and we'll have a write-up. We also may have some other things that we can do depending on our time. The write-ups, I'm hoping you'll have time to just go ahead and get them done so there won't be a lot of outside work that you have to do. So another emphasis is anytime you have an assignment, it's really important for HIPAA purposes and confidentiality, only put the person's initials and no true information, no names or social security names, social security numbers, or any real addresses. You really want to just make those up. We do require that when you're doing your performance exams, the last one that you'll do, the head-to-toe performance exam, that you wear a lab coat, and it certainly can be the lab coat you have from your own nursing college. Eventually you're going to need a College of Nursing name tag, but if you don't have that, then please wear your name tag that you have from Walters State so that I can get to know you. And you might even want to wear it each lab session so I can get to know you better. I just have a reminder in here. The next page of the lab is shared by other students at Walters State, and that we are guests. So we're appreciative that they're letting us use this lab for the course. We're going to treat it with respect. Same rules apply, I'm sure, when you're in the lab yourself, but no shoes, no eating or drinking, and of course we're going to leave it better than it was. So I know this is kind of fast, but I wanted to at least get a little bit through the syllabus with you. And now what I'd like to do also, you have a course calendar, a couple pages, and it shows that for this summer, the first thing that you're probably already doing, I hope, is that you're reviewing the chapters in the textbook and you're studying the PowerPoints and notes. And I gave you in your D2L site, that's all the content through Module 5. So the content that will be on the first test has to do with introduction to health assessment, including some of the critical thinking concepts, health promotion strategies for, I usually have a couple of cultural questions on my exams, and also what the health history, the parts of the health history. Chapter 4 is awesome about health history. It goes through all the different parts of the health history and what is expected. And I'm sure you've done somewhat of a health history, if not a total one. But that is an important component here. I understood from previous students that you'd already done a mini mental status exam and MMSE. So I've taken that out of the assignments that we're going to do. So we will be talking about that. You can eliminate the MMSE. There is a chapter also on substance abuse and domestic violence that you're responsible for. And then there's some general assessment techniques, and also a chapter on general survey, which of course means inspection, and then vital signs, pain assessment, and skin, hair, and nails. So quite a bit of chapters. It looks like it's through chapter 12 in Jarvis. And as I said, when we come together, which of course it's June 10th is our first date together, we will take the first exam, and then we will have a practice of the skin, hair, and nails at that time. And so that will be lab 1, which is on the next page. It talks about it. I also will demonstrate for you the CCE head to toe. Maybe we can use a real person. I'm hoping to tape record it on a model or on a mannequin. And then we will also be doing the skin, hair, and nails practice and write up that day. And so again, I will be glad to show you that and work with you on that. So each time I also put down what the next lecture content would be. So you can see that after the first lab, you're going to be reviewing head, eyes, ears, nose, and throat, thorax and lungs, heart and neck vessels. And that will lead us into our next exam and our lab 2. And you can see the date on that is July 1st and so on. So this is the schedule that you need. So if you have any questions about this syllabus, I would love for you to email me, or I've had a couple students already email me, but email me or send me a message through the discussion board. All right, The other thing I'd like to go over is the course packet. And the course packet I just put online yesterday because I finished it. And this is the packet that will help guide our lab together, our lab sessions together. So it's under your content, and it's the Pediatric Health Assessment course packet. So if you will look with me, it does have page numbers. Page 2 is the directions for the health history. And that's the first thing that you're going to see. Okay, so actually, in the health packet, in the course packet, health assessment course packet, you are going to see different handouts. You're going to see forms for the health history assignment. You're going to see forms for the lab practices that we'll be coming together with. You also will be seeing some forms for each of the write-ups, the skin, hair, and nails write-up, and also the write-up for lungs and heart, and also for the abdomen. Those are the major ones that we'll be doing. We also will be doing other systems that we won't be writing up, and those are in there as well. And then the last thing that we'll be doing together is the final head-to-toe performance exam. So if you will look in your packet, towards the end of your packet, you will find a head-to-toe. It says the CCE performance final exam guidelines, and these are the guidelines that tell you exactly how you need to proceed as far as selecting a person and what is expected during the exam. Then what you're going to see is it says the head-to-toe exam grading criteria and practice guide. Now, it's like a chart, and on one side of the chart, you've got, it's two sides. On one side of the chart, you have what is actually your performance going to be, and then on the other side, you've got what the write-up is going to look like. And we'll go over it again in class. But when we're actually practicing this exam, and you're practicing every time together, these are the criteria that you need. So look at that, and you will be practicing this and pulling it together so that the end time together, you will have this mastered, and you're going to be able to do it. And again, I will demonstrate it for you. It looks like a lot, but it's not when you pull it all together. You are also going to see in your packet a head-to-toe examination recording guide. It looks like just a form that has just categories of systems, and then it's kind of blank. This is the form you actually get to use when you're doing your head-to-toe performance exam. You'll get to have this with you, so at least you'll see the categories, and then you'll get to write down notes if you need to. After you do your exam, which honestly takes about probably 20 minutes at the most, 15 to 20 minutes, then you will do it on your partner. Then if your partner is a student, they will do it on you. And then both of you will sit down, and using that blank sheet that you had, you'll sit down and write up your documentation for your head-to-toe. We'll go over it again when I see you in class, but that takes another 10 minutes maybe. So the whole process for each of you to examine each other and then sit down for the write-up takes about an hour and 15 minutes, something like that. And we will schedule that as our very last class. You can see at the end of the packet, it is a head-to-toe grade sheet. And this is the grade sheet where I will actually be looking and grading you as you do your exam on your partner. It looks a little bit daunting, but you can see that there are some starred items. And the starred items are really important because those are the ones that you just have to nail. And of course, you're going to make, what I found is that this head-to-toe exam, most people make 95 or above on it, and it really helps the grade. So we will go into more detail with the Pediatric Health Assessment packet when I meet with you, but I wanted to give just an overview and let you see who you're going to be meeting on that first lab day. And again, after you've read through the material, if you have any questions, let me know. One more thing I'd like to say is check on your D2L site at least every day or two, because I do post announcements and updates. And what I'm getting ready to do is post a few sheets. I told you that having your lab book is a good idea, but if you don't have your lab book, that I will be posting the lab tools for the different write-ups that you'll need and for our lab. So I am going to be putting under course materials a health history form that is from your Jarvis lab manual. I also am going to be putting up some working tools, or I call them worksheets, that are from the lab manual, so that when you come in for lab, you've got a skin, hair, and nails, you've got a respiratory or thorax, you have a heart, and you have an abdominal write-up page where you can take notes on your partner, do the exam and take notes, and then take this to a piece of paper and write up your paragraph to turn in for a grade. So you can see also in the course or the lab packet that there's a grading tool for each of these assignments. So we'll pull it all together when I see you that first day, and let me know if you have any questions in the meantime. Thank you so much, and I see you soon.